Thank you so much, Sue, for your very kind introduction. I hope you've all had a good break. I have to tell you, for those that were in Dr. Jenny Hall's talk just before, I went off and did a few stitches in my knitting. So I do think that kind of moment to reflect and pause. But this talk's going to be quite fast-paced because we've got a lot to take in. Many of you know me really well, but inevitably some of you won't know me at all. I believe some of you might be joining from Australia, which is particularly exciting because we are soon to take our NHS-approved Baby Buddy app to Australia, thanks to some federal funding. In my talk today, I'm going to be focusing on the story behind Baby Buddy 2.0, the charity, our raison d'etre, what we get up every morning to do, the fantastic team, and how Baby Buddy 2.0 is not just the next step on our journey, but a step change in terms of the difference that we can make. And at the heart of that are you, midwives and other frontline professionals and families. It's about the change that we can drive together. So as Sue mentioned, I set up Best Beginnings many moons ago. And as a charity, we've been unwavering in our focus. We work to give every child the best start and are really focused on reducing inequalities too. And that's been the case since 2006. And what the pandemic has done is, I guess, shone a stark light on pre-existing inequalities and exacerbated them. So actually the need for our work is greater than ever. We exist to directly inform and empower parents and to support the incredible work you do as frontline professionals supporting families so that together we can drive positive change. Some of you may not know Best Beginnings as a charity, although I'm hoping that most of you will, but you will definitely know, especially those of you who've been qualified a longer period, know some of our earlier resources. So the Bump to Breastfeeding DVD, the Small Wonders DVD, the power of film to open people's eyes to possibility. Many of you will have actually been involved in shaping those resources and the first version of Baby Buddy, and I'm sure some of you as part of this community watching now, will also have been involved in shaping the new version that's launching this summer. And one thing combines all that we do, and that's the idea of creating national resources that are for families and healthcare professionals, and they're not instead of anything. Now that sounds interesting because actually no, why would I be proud of that? But I think it's incredibly important. You guys do pivotal work day in, day out. The idea with Baby Buddy is it's technology to support the relationship between the family and the midwife, for families to understand the importance of bonding and attunement, not in a technical sense, but through film and through little snippets of information. And what we've been doing over all these years is developing and then iterating what we do. So there's been lots of academic evaluations. I'm not going to be talking about them unless there's time at the end, rather sharing with you the journey and inviting you to jump on board and be part of this really exciting next phase. And that's why, with our guiding principles of innovation, evidence, and collaboration, I couldn't help myself but get us all doing a bit of a quiz. It's been a long day on Zoom. Oh my gosh, someone's already in. Or maybe that was me testing it before. Gosh, I don't quite know what happened then. So this is something called menti.com. Some of you will know of it, some won't. Maybe it was already put up on the chat and that's why people got busy, which is fine. So if you could all go, if you can, on your phone to menti.com and type in that number. I'll read it out, 28231667. And once you're in, I want you to vote yes or no. Do you know how to use Mentimeter? So the yeses are definitely on the up. I'm intrigued by the no's. That was a bit of a trick question from me because, of course, the fact that you've been able to answer no means that you do know. That's all there is to Mentimeter. It doesn't get more complicated than that. Questions coming in, and then an opportunity to answer. So the numbers, we've got lots of people saying no, but trust me, if you've answered, you know how to use Mentimeter. I'm going to move on to the next question, which gives me more of a flavour of who's here. So if you didn't reach for your phone first time, go for it now, menti.com, and the code at the top, 2823 1667. I'd love to get a flavour of who's in the space. And we've got people from charities. Well, I'm expecting qualified midwives to be the front runner here. And also a hearty number of student midwives. I didn't know whether there'd be parents or not, and or other obstetricians or GPs. But I guess the key thing is, which is helpful for me, I mean, it's interesting to see there's plenty of presence from charities attending, which is great. I mean, at Best Beginnings, we're part of the Pregnancy and Baby Charity Network, and together we're working to support all aspects of the implementation of better births, and we've put the word out there, so it could be through there. But I guess fundamentally, I've aimed my talk at midwives and student midwives, because Baby Buddy is a tool to support you in the vital work you do with families. So I'm going to move on, and the next question might feel very strange, but I want you to know it's not only because I want a good recommendation. I'll read it out to those of you that are still reaching for your phone. The question is, can you list your favorite 3 TV series since the pandemic started? There's a bit of kind of my own need, trying to decide what to dive into next. We just got to the end of Bridgerton. And you just get to write 3. Oh, okay, This Is Us, Bridgerton. So I absolutely love both. This Is Us was my complete favourite. You can each enter 3. And I'll kind of give away as it all... Oh my gosh, look how quickly that happened. So if someone recommends something that someone else already has, that's fine. And what you'll see is that there'll be a front runner or runners emerging. This Is Us is in the front, but I am looking for my next series, and the one I can see coming up, well, Call the Midwife, and I love Call the Midwife, and then it's just keeping going. Okay, so I'm going to say this word at the end, and perhaps through Sue we can share it with everybody as an unexpected benefit of coming on today's course. But I think the key thing that I want you to bear in mind is I am more likely to watch these that have been recommended by people I trust. And midwives are people I trust, compared to if I saw a trailer or someone I just passed in the street. So you are so loved and trusted by families. So the way you decide to, or if you choose to recommend Baby Buddy, it's much more likely to be used. And the reality is that more than 3/4 of women find out about Baby Buddy from their healthcare professional. So I think based on this vote, let's close that one. It's Call of Duty and Call the Midwife. Sorry, Line of Duty and Call the Midwife are next on my list. Next quick quiz, and then we're back into the presentation, and then there'll be a NABA quiz at the end. So this is to give me a sense of what best describes you and Baby Buddy. Generally call it Baby Buddy, but we're calling it 1.0 just because you're in the inside track with us and we're about to launch a new version. So, so far, the majority of you didn't know about it. Some of you have heard about it and have neither used it or recommended. There's in third place, there are people that have used it and recommended it. Basically, it's all across the piece, but I'd say the majority of those of you answering hadn't heard about it. So that's why I'm here. So you can keep the scores coming in for later, it'd be interesting, but I am gonna move on, or that might close it, back to the PowerPoint. Here we go. So let me tell you about what's already out there, and then I'll show you what's coming soon. So Baby Buddy is an NHS-approved app that we launched in 2014. It's free and advert free, and it's endorsed by all the relevant Royal Colleges. And talk to anyone in the Best Beginnings team. It's a total labour of love. We've had over 300,000 registered users, and more than 85% of them are mums. We're really proud of the fact that more than 10,000 healthcare professionals have downloaded it. And if you're here and haven't yet downloaded it, then I would, because the new version's not coming out till July. And then you can see and watch the 300 plus films, all of which have been approved by all of the relevant Royal Colleges and professional bodies. But more importantly, all of which have been reviewed and had input from our parent panel of diverse parents. Now, you'll also see that we've had over 20,000 fathers using and partners using Baby Buddy. And one of the step changes of the new version is, rather than having to read a lot of content that was aimed at mums, we finally got the funding from the National Lottery, and the new version is going to include daily information for fathers as well. So what's already out there is working well. It's won a lot of awards, and it's NHS approved. And we've got a lot of independent academic evaluation, finding it to be effective in a number of ways, including increased breastfeeding rates. And as a charity committed to working long-term to support all parents of all backgrounds, we were determined to make this step change. So in the new version, all the old films will be there. There's just a few that have been archived, but I would say it's more than 99% are moving across, including films featuring our very own Chief Midwifery Officer, the wonderful Professor Jacqueline Dunkley-Bent, who we do a lot of work with. She's passionate about our work because of our focus on reducing inequalities, and because of our data showing that mums who are from Black, Asian and other minority ethnic groups, and mums for whom English isn't their first language, and young mums are more likely to use it, and that it's used by parents of all backgrounds. So that's all staying. The co-creation is staying, but for the moment, it just looks so weird to me seeing all this togetherness. Hopefully it won't be too long before we're back out in the community doing face-to-face workshops with families and professionals. But for now, we, Best Beginnings, as of today, are inviting a very broad, everyone here, and you can forward on the link that we'll share at the end, to be part of this next phase of the journey, kind of joining the Best Beginnings family. And you're in very good hands. So the old version and the new version have always had expert input and our awesome parent panel of diverse parents. One of the exciting things about the new version is the father's pathway. And in line with our commitment to collaboration and our passion for collaboration, we've been working with some awesome charities and other groups to create daily content. And we want more parents and professionals to play with Baby Buddy 2.0 before it launches. And that's why I'm kind of doing something that you're not supposed to do, which is share you an app. I'm going to show you some films that I filmed this morning before it's finished, because together we're going to make it even better. But first, I do want to just pause, because as those of you who know me know, I get very passionate about what we're doing here. And sometimes in that passion, I don't take the time to explain the rigor of what we're doing, the solid theoretical underpinnings of this work. And I just need to pause and give you all a moment to pause, so that you understand that it may look like an app, and it is an app. And all apps are not the same. Someone in my team called Baby Buddy a TARDIS. You know, the telephone box with Doctor Who. It's a telephone box on the outside, you look in and there's a world in there. And Baby Buddy is not dissimilar, both in terms of the academic thinking underpinning it and in terms of the depth and breadth of content. If you look to our annual report on our website, you can find out more. But all of these theoretical kind of underpinnings are vital, and they are informing and shaping everything that we're doing with Baby Buddy 2.0. Something else that I just want to touch upon is how Baby Buddy actively supports the combination of content and features and signposting and quality assuredness, and actively support these well-established protective factors of perinatal well-being. It's there to inform and empower, to support seeking support, and actually to support relationships. There's lots of films about strengthening your relationship. Some of them are actually about arguing better. I'll leave you to find them yourselves. And also one of the things coming across to the new version is this 24/7 access to support. Because with all the right protective factors in place, still many of us, we're a member of the Heads Together campaign, we all have mental health. Sometimes it's good, sometimes it's not so good. And all Baby Buddy users have free and confidential access to this clinically assured crisis text messenger. And the need for the work has increased because of the pandemic. There's a whole other talk I could give about some another piece of work that we're doing that has been a bit of an in-depth dive about the support that we're giving and the need for more, and the difference Baby Buddy is making. These are just a few tasters of feedback from families about how the app has been there. Almost some of them use the word lifeline. Now, this is data from a year ago, the quarter of last year, and I just haven't had a chance to pull it off. I was so busy focusing on the app demo. But at that point, there were 10 areas in the UK where more than a quarter of the birth cohort were using Baby Buddy. So if you look at all the mums in Newham, 26% were using Baby Buddy in that quarter, based as in a quarter of the birth cohort. Look at the numbers, and it was a quarter of them, based on the time window. And what we are aiming with Baby Buddy 2.0 is much, much higher. So as a charity, we've just been commissioned by Surrey Heartlands ICS to take the app, which is always going to be free, always going to be freely available across the whole of the UK, but to really do a purposeful piece of work to think how it can support all aspects of local care. And the first 1,001 days, the maternity journey and continuity of carer. And that's something I'm passionate about, having been involved in better births from the beginning. And I guess the key thing I want to, if you only get one thing from this talk, I want you to feel and know that this app is for you as midwives. Yes, of course it's for families. It's vitally important for families, and it's to support you in that pivotal work you do. The way you can recommend content or films, the way that you can reinforce something that you've discussed, whether that be around maternal mental health or smoking cessation, or films highlighting the importance of keeping appointments. They're all in there to support you in your work. And one of the best things about the new version is there's going to be a space called Shared Space where you can recommend films and content to specific families that you're supporting. And that same feature can be used to support, for example, if there's a couple relationship, or it could be a single mum and her mum or her big sister. These qual statements coming through are from one of the papers that has been published on Baby Buddy. So it doesn't take time, but it's as useful as you want it to be. And in a sense, it's there to just support the flow of information and the flow of support. I don't know how many of you know this nurturing care framework. It's from WHO and UNICEF and the World Bank. And on the right, you can see the circles of support, the child, the parents, the community. And the app, the old version did a lot of this, but the new version even more so helps those contact points, that relationship, and data flowing as well. We're developing a maternity voices feedback feature, so parents' voices can feed to that MVP. So where are we up to on this Baby Buddy journey? So we got funding over a year ago for the National Lottery, and we've been really busy. The team is phenomenal. And we are now in this internal testing phase. Come May, you'll all have the chance to test it if you want. Come July, it will be out there. Now, I have to caveat all of this to say we're dealing with technology here. So if there's slippage, you must forgive me, but we're working literally round the clock on this time frame. So why am I here? 20th of April giving you a sneak preview. Isn't that crazy? And I guess it is this core belief in co-creation. They say it takes a village to raise a child. You know, we're in this together. What we're creating is a powerful tool, and you're going to help us make it even better. You know, why midwives? You support the birth of beautiful life every day. We want you to help us and support the birth of Baby Buddy so that you can support yourselves and more families. So here goes. And this is with some nervousness. This was filmed by me early this morning, and I just filmed it off what's called an APK. So it was a web browser that had this in, and I was pressing buttons. You can see where my mouse is. It sort of moves around as a little circle. And I'll talk you through, first of all, the onboarding process, and then a few more features. And I will be done in time, I promise, Sue. So as we start with Baby Buddy, I'm coming in as if I'm someone new. And like the old app, it asks for your name, always your name, because then the content gives you information mentioning you by name. And like the current version, we ask for your postcode. And what we do with that is two things. One, what we've always done, which it then gets anonymized and actually cleansed of that level of granularity, but people know their whole postcode. And that allows us to look at the data of uptake and usage across the whole country. So that a particular locality, we can know what percentage of the birth cohort is using it. The other benefit of the postcode moving forward, for example, with Surrey, if someone puts in a Surrey postcode, then as well as what everyone gets across the UK, if they want to send specific push notifications or features for that locality, because we know where people are, they can get it. So if you're in an area where Baby Buddy is being actively promoted, then you will get to see kind of graphs or data on how many people in your locality are using it. Next feature. Okay, one of the big things, and I skipped over, I don't know if you saw on the last slide, but NHS login. So we're working with NHSX and NHS Digital on that, and we've got NHS login. So you can see that you can add a pregnancy and a child and as many children as you want. And that's another new thing, because people have babies and they also then give birth and get pregnant again. So I've done a scenario here where I've gone in as the mum. There is a healthcare professional route in, which will make life much easier for you. So you can preset, and it can be preset with different ages of babies. But with this one, I'm creating a boy. I called him Josh after my youngest. And he was born in this scenario, not the teenager that just came home from school. He was born in the last autumn. And I can, at this point, if I was on an actual phone rather than this emulator, I could add an actual photo, and I could change the photo as and when he grew even cuter or changed or whatever it might be. You can see that I can put in the feeding status. And as with Baby Buddy 1.0, the content that you get depends on the information that you give. So it's an incredibly personalized journey, in line with better births and that personalization and supporting choice. That's at the heart of what we're building here. Now your feeding status might change, so you can come in and change that. Now onto the pregnancy side, it's not dissimilar, so I'll just talk around it as it's coming in. Women may come to an appointment before they're with a due date that they believe. They'll put in the due date, and then of course that due date might change. So if it does change, they can change it in the app, of course. Now, the baby name here, I've gone for Sophie because that is my favourite girl's name, but it might be at this stage of pregnancy that you're putting in Bubbles or Bump, or as a midwife, if you're supporting the mum using the app and she's not put a name in for the baby, it's something to encourage her to do. It's all about that mind-mindedness. And in fact, some of the most popular films in the app are the in utero MRI images of babies moving. So the whole app is constructed to help families get their head in the game, even early in pregnancy. If we think about this through the lens of healthy behaviours, or let's think of smoking cessation. If you've not actually acknowledged that you are having a baby, it's really tough to quit smoking. So everything that's here that might feel quite light or frivolous is actually really purposeful, including finding out more about you. So if I said I was the dad, I would get that content, different content. Now, my age, I'm not going to put in my real age this morning, I think. But the reason we ask for age, in time there may be different content depending on age. We're going to change some of the wording on the screens, but right from the beginning, that's again our commitment to public health. We want to know the extent to which the age distribution of Baby Buddy users does or doesn't match the national distribution from ONS data. And what's currently happening is it's more used by younger mums, but broadly it matches the whole age range. Okay, we're in. I talked through it all as it was all unfurling. We're now in, it's going to look prettier than that there, but you can see it's a nugget of knowledge every day, little prompts for action. Some people say health by stealth, but we're not being sneaky here. It's here to empower. And by you knowing what parents are seeing, then that will help you in your relationship with them. I'm on the postnatal side now on this demo. I think I'm going to move on in the interest of time because I've got 2 minutes left. Oh, my giddy aunt. You all are going to need to become beta testers so you can do the deep dive into Baby Buddy. What I want to just let you all know that it is from the beginning going to be a digital child health record, and we are working with NHSX and NHS Digital very closely. And before too long, we hope, timing hasn't been confirmed, the idea is that you can connect, so your child's electronic data will flow through. So this is a digital child health record. There are other sort of suppliers out there that are going through, jumping all these hoops. There aren't many. I guess what we give is all the information, all that evidence-based content and empowering information, as well as all this child health, child health record information right in your hands. And all the same films and content and more is being added all the time. I told you about the Save to Space feature. I just have to quickly show you the choice of place of birth feature. And then we can stop, and we might get to the quiz and we might not. Basically, wherever you are in the country, across the UK, you put in your postcode. We've been working so hard on this, the team, when I say we, and Miranda Scallion, who some of you might know, she actually already had this incredible database that we've been working on and developing. Based on postcode, it will offer up the maternity hospitals from which obviously the alongside and all the options flow from. In this scenario, I've put in a Birmingham postcode, this being a Midlands focused conference. And I'm particularly interested in this scenario with Birmingham Heartlands Hospital because I have a friend that gave birth there. Although it's further away, I want to find out a bit about it. So you'd click through, and then all this information would flow from various clever, they're called APIs. You don't need to worry about it, but basically the information flows and it's kept up to date because of the system. Here I'm going to click on birth centre and it takes me straight through. So this is supporting informed choice. And there's another feature that I'm actually not having time to demo, which is the personal care plans. So within the app, and they sort of interconnect to each other, you can create your own personal care plans. And all of this is designed to be used to support continuity of carer. Do you imagine, as a continuity of carer, midwife or any midwife, this is a tool in your box to support parents to become kind of more actively involved in their care. They can develop their own care plans and discuss them with you. You can develop them in appointments. This is about the power of collaboration. And on that note, I did have a quiz, but I don't think I'm allowed to.
No, do the quiz, do the quiz.
I do the quiz? If you don't, okay, let's do the quiz. Right. That was the biggest whistle stop.
It was.
There we go. We're back on Mentimeter. Okay. And it might be that everyone's too tired and has gone home. But if you are still on, it would be really interesting. So here, this is the first stage of a journey of feedback. We want you to be involved. There's a link I'm going to share so that in an unhurried way, you can do whatever you might like, which might be become a beta tester or just get newsletter updates or whatever you want. If you're on the call and adding, you can choose as many features as you want. Like some of you might feel that all of these different features are going to be useful, and others of you might only kind of prioritize some. What's interesting so far is the quick healthcare professional login is useful, but not kind of a game changer. At the moment, the thing that's in the lead is the films and the content, that core content that we've got and that we're growing. I think maybe I should have separated the mothers and the fathers, but I'm really pleased that that's actually joint lead at the moment, because it's not, it's been so much work from so many people and different organizations to bring that to the fore. So I don't know if that can carry on in the background. I think it can, so do carry on voting and we'll look at it later. And then all I want to do is just invite you to continue on this journey with you. It's been a long day of an awesome conference. And this is also the next stage of this new journey for Best Beginnings, that we're really opening up our hearts and our heads, you know, in terms of get involved however much you want to, because we firmly believe that together we can make a difference for future generations. And so all I need to say is that link is case sensitive. I know it's a bit of a drag, and I think someone might be cutting and pasting it into the chat. So from that link, join the Best Beginnings family, but with a capital at the beginning of each. And starting with that bit.ly, it will take you to a form where we ask a bunch more questions and then give you the opportunity, if you want, to become beta testers and or get the newsletter and or. There's lots of options. Thank you so much for your time, and thank you to Sue and everyone that's organised this brilliant day.
Yeah. Thank you so much, Alison. I think your passion and your excitement are so infectious. I think people are going to really feel quite rejuvenated from that. And I'm sure you're going to have a lot more family members now in the Best Beginnings family. So fabulous. I do have a couple of questions. Yes. I've got a question from Anne Remmers. Hi, Anne.
Hello.
Says, Alison, is there a section for preterm birth?
Oh, Anne. So all of the Small Wonders films, those they've broken down. That was such a labour of love, having had 2 children born early and poorly, and that being the whole backstory behind the charity. All of the premature and sick baby films are going into Baby Buddy. Also, there's a moment on the app which I didn't show where you give birth, and if you give birth and you're not full term, it flags additional information. A lot of what the app does, which I realise I didn't discuss enough, is signpost to different charities. So this is all about Best Beginnings as a piece of a huge ecosystem, and how what we're doing is sending parents to lots of other support and information. So there'll definitely be shown where the premature and sick baby films are. Those, you know, I have to say I'm so proud of those films. For those of you that don't know, we filmed for over a year with families, with many with 24, 25, 26 weekers, others with later prems, and followed them on their journey. And I'm still in touch with many of those families. So those films will be in there. Our big plan, which has always been the plan, but we haven't yet secured the funding, you know, because we're a charity, everything depends on the funding, is to create a content pathway or content pathways for different levels of prematurity or other kind of special aspects of the child. So that isn't there yet. It's something I've discussed with for example, Bliss and other charities with and we don't currently have the funding to do that. But what we will be doing is adding, if anyone, we can just add more FAQs in there, frequently asked questions. So yeah, it doesn't do everything I want it to do yet, but this is a multi-year journey. And I guess the other thing is that I should have flagged is I see this next phase as being at least another 10 years. And although what we're launching this year goes to the first birthday and is aimed at term parents, and I guess the big shift, term babies is the big shift, is that there's content for different types of parents. We separately have convened, it's not separate, it's connected, a partnership called the Early Years Digital Partnership, which is more than 40 organisations, including more than 20 national charities. And together we're seeking funding to create more content to take this to the 5th birthday, but also with different content pathways. So what I'd say, Anne, is watch this space and do drop me an email. And who knows where we might get the funding from.
Fabulous. And sign up to Baby Buddy. That's the other thing to do, because then you learn a lot by using it and just checking in on what you can learn from it. Another question from Rachel. She says, is the option for partners aimed at dads or all non-birth parents of any gender? That's a very current issue, isn't it?
Yes. No, it's a really good question. So we're absolutely, the onboarding allows for every, we've been working with a number of individuals and organisations, LGBTQ plus focus. So the way you onboard, it doesn't assume your gender. I don't know if you saw at the beginning, it mentioned, are you pregnant, are you the father, or are you another birth parent? And there's also options around pronouns. So we are committed to, I guess, diversity and inclusion in all its forms, not just specifically around ethnicity or socioeconomic. We're passionate about supporting all parents. We are doing some work and want to do more. It's something that we're actively seeking funding. Just like we've done this intense dive for fathers, we also want to do an intense dive for a more bespoke LGBTQ plus pathway, what's actually a series of pathways. So whoever asked the question, if you want to be involved, we'd be delighted. What do they say? You can get there quickly alone or further together. I might have not said it
together. That
so
sounds
it's
right.
on the plan, and yes, please come drop me an email.
Fabulous. Well, thank you, Rachel, for that question. And the final question is from Sian. And she says, sorry if this has been covered, but do you have any plans to extend the app for more than 6 months postnatally?
Oh, that's a really good question, because it showed I rushed too much.
No, it's a lot to cover.
Yeah. So the version that is launching this summer will go to the 1st birthday. And then absolutely our commitment is to the 5th birthday. So Baby Buddy is explicitly being developed, and the partnership, the Early Years Digital Partnership, this piece of technology is like a channel. It's like a one-stop shop to support the implementation of the Healthy Child Programme from a public health perspective, to support frontline professionals in the work they do with families, and crucially to support families on their journey. So yeah, and please be part of the journey with us, because yeah, we are committed to get to the 5th birthday.
Fabulous. I think we can only take you that far now, Alison. Thank you so much for joining us. Thank you for giving us a sort of special preview of the Baby Buddy Mark II. This is going to be fabulous. So those of you out there, do sign up, go in there and have a chance to co-produce, because it's very exciting, and it's you really feel part of it, and it's a really good tool for you to share with women and families that you're working with. So thank you so much, Alison, for being with us. I know we have to move on now because we're coming to the end, and somewhere there should be a collage. I'm not sure where it is. If people have put in some, we've got the collage coming.
Thank you so much for having me, Sue.
Thank you, Alison.
So good to be part of this.
I know, and good luck. We'll have you again, I'm sure. Oh, lap warmer. Oh, look. Oh, wonderful. Oh, I recognise that one. Fabulous. fabulous. I know. Oh, this is fabulous. I think our audience have been absolutely fabulous. We've had some superb questions, and look at all that feedback and images. Thank you to everybody who's provided feedback.